Off the table, the latest attempt at changing the healthcare system.
God bless Senator McCain. It's a great act of leadership.
Patients in limbo. What's next for hundreds of thousands of Arizonans?
What we're really hoping is that we don't take steps backward.
Plus, the political fallout over healthcare. This is Arizona Week. Hello and thanks for joining us. The Republican plan to repeal and replace the Affordable Care Act ended this week. The Graham-Cassidy proposal started in the Senate and never made it out, but technically it's not dead. Christopher Conover here with more on where the bill sits. Currently, this sort of feels like high school civics. Take me back to why there was a rush.
There was a rush, and this wasn't in high school civics, but there was a rush because the 30th of September is the end of the fiscal year. And this bill was tied to the budget, so it had, for fiscal 17, the one that ends on the 30th of September, so if it didn't pass before then, they had to get a higher number of votes. Thus, they were just looking for 51 votes, which they obviously could not get. Now, to pass it, they would need at least 60.
And we won't get there, but the bill, though, not really dead. It sits there.
Exactly. It sits there. It's had a committee hearing. A second committee has agreed to hear it. It could be brought back up later. It's not dead because no legislative body voted it down and killed it. So it's just out there, basically like every other bill, working its way through the process right now.
Could it be reinvented in a different form sometime over the next few months?
Absolutely. It could be rewritten and taken to another committee. It could be taken to that committee and amendments put on it. It could be amended on the floor of the Senate at a later date. And that, if we look back, is what John McCain wanted. That's regular order, what he talked about in July, saying that's what he wanted the health care bill to go through committees, go through amendments, go through a full debate.
It's rare for a bill to get so much attention, especially in its preliminary stages. But repealing and replacing the Affordable Care Act affects between 20 and 30 million Americans, and long-term comes with a price tag worth billions. Under the ACA, Arizona is one of the states that expanded Medicaid dramatically. Greg Vigdor from the Arizona Hospital and Healthcare Association now with what he thinks Arizona does need moving forward.
What we've said from the start, and the start was before the election, was we have some serious problems with the Affordable Care Act, especially with respect to the exchanges, the individual and family market. We should be working to find solutions to that. There actually has been a bipartisan process going on in Congress since Labor Day to do that. Senator Alexander, Senator Murray, Democrat, Republican, they were having productive conversations. Since the introduction of this legislation, those conversations have stopped. We would go back there. We have our own ideas for how you might do that, but it's more important that we come together as Americans to solve these problems, and that's the primary problem that's out there that needs fixing, not the Medicaid program, which works fairly well in Arizona, actually.
Medicaid, you think, is okay the way it is right now?
Yes, it's not perfect. Every program has things that needs to get better, but in Arizona, it's really been a state-developed system that's kind of unique, somewhat akin to what they're talking about developing with the block grants. And so we kind of have that homespun Arizona way that's really been pretty effective and is supported by a wide range of providers, consumers, health plans, and others. And that's what we'd like to keep into effect and not try to do it again with millions and billions of dollars less money to do it.
Has Medicaid grown too quickly in Arizona, perhaps, that it won't be able to sustain itself?
Well, there's always the question about the money and the ongoing cost to health care and how it continues to rise. And so we have to address those issues. But let's remember, back to the campaign again, the #1 issue for voters around health care was not the Affordable Care Act, it was the high cost of prescription drugs. Those costs are also on the hospitals and others who have to pay those, and they're 19% is typically the number I get shared with by our hospital administrators. There's been nothing going on with respect to solving that. So again, if we started looking at the problems that were actually out there and practically rolling up our sleeves and working together to solve those, we'd be on a better track.
Would you like to see the state have more control over health care?
I think it's still a private marketplace matter to be dealt with, and the state has its proper role, but so does the federal government in terms of setting boundaries and setting approaches. We really can't have 50 different state systems and believe it's not going to be anything but a race to the bottom of who can pay the least as different states are competing for businesses, for example. So we need all those parts. It's always been complicated. It's always been a multi-factored approach to who's responsible for healthcare, including patients themselves, who have to take care of themselves. So it's everybody's responsibility. That's how we see the world.
How much does the association appreciate John McCain right now here in Arizona?
God bless Senator McCain. It's a great act of leadership. We really understand his principled leadership of looking at the process. We know he's concerned about the impact on Arizona. We know he's concerned about the impact on Americans, but he's also really somebody who believes in the Senate as one of the great institutions of democratic debate. And just how this has happened has left a bad taste not only in his mouth, but I think in our mouth, watching how it's happened, giving it such an important topic for every American.
How valuable has the ACA been for Arizona?
Medicaid expansion, we call it restoration, has been critical to so many patients, 500,000 people in the state of Arizona, many of whom are very sick, many of them have pre-existing conditions and have no other way to get coverage. It's also helped stabilize the healthcare system, which was in great trouble out of the Great Recession because of the rollback of some Arizona coverage programs for exactly the same population. And that has also stabilized our economy and allowed healthcare to be a leader in our economic recovery.
Among the organizations watching healthcare negotiations closely, the Arizona Alliance for Community Health Centers. Every state in the U.S. has an agreement with the Department of Health and Human Services to monitor healthcare discussions and then provide support to federally qualified healthcare clinics. Here's Tara McCollum from the Arizona Alliance for Community Health Centers.
In Arizona, we serve about 600,000 Arizonans. We have 23 federally qualified health centers. That includes 2 lookalikes. And we also provide school-based clinic services as well as mobile units. And there are 156 health centers throughout the state of Arizona that serve in medically underserved areas.
These are also medically underserved but also economically challenged communities and patients you're dealing with.
Yes, absolutely.
These are folks who, before the Affordable Care Act, did not have access to maybe adequate health care.
You're correct. Now, as a federally qualified health center, you can't turn people away if they lack insurance or the ability to pay. So we serve people on a sliding fee scale. They are not free clinics, but people can apply for a sliding fee scale fee.
Okay. In this discussion with this latest health care bill, what could happen to these 600,000 individuals in Arizona?
We know that with that patient population is pretty broad. It is not all Medicaid. But our biggest concern is the Medicaid piece, because under Medicaid, 47 to 67% of our patients are Medicaid patients. That is really high, and especially in the rural areas. In many of those areas, we're the only provider for 100 to 200 square miles. And without that Medicaid coverage, what those patients face is they can come in and do the sliding fee scale services, but it makes it much more difficult for us to move them into a specialty service or hospitalization. Those are all covered under Medicaid. So what the Medicaid expansion did was allow at least 400,000 more people to come onto the Medicaid rolls and have access to health care through Medicaid.
Why do we have so many people in Arizona covered by Medicaid?
Well, we have to remember that the folks that are on Medicaid are generally people who are working. So 80% of the Medicaid enrollees are working. Others are children. We have the elderly, and we also have this disabled. So this is a very broad population of people, and we also have those who have mental illness that are included in this Medicaid population. The primary reason why they are on is they may be in one of those first 3 categories of the elderly, the disabled, the mentally disabled, or they could be children that are part of this program. But for the others that are working, they just don't make enough to be able to afford health care coverage. So for those folks, they are working very hard, but they're not quite at that income level where they can actually afford to do anything as far as their health care coverage.
If these people lose coverage, how does that change this community, this state?
Well, we're going to go back to where we were before. People using the ER, having the inability to access coverage. And what we saw a lot of is we would screen people for things like breast cancer, and there would be no place to send them, because there's a certain point where oncologists and doctors can't take everybody who doesn't have health care coverage, because the large amount of uncompensated care presents a risk to those healthcare organizations.
Is it fair to say that the Affordable Care Act saved lives in Arizona?
Oh, absolutely. I would say that emphatically, that it did save lives. And we have a lot of families and individuals who have attested to that.
Among the federally qualified health care clinics is El Rio Community Health Center. Physicians there serve about 90,000 patients every year. Dr. Lisa Soltani is among them. She joins me now. Thank you so much for being here.
Thank you so much for inviting me.
I imagine that there were some physicians like yourself who were relieved when Graham Cassidy did not go the direction many had intended.
Yes, that's absolutely right. So I would say probably most physicians and even hospitals were very relieved to have that off the table. And it's really been a rocky few months. There have been a series of Republican proposals that look to really take us backward in terms of the numbers of people that we have been able to cover and give access to health care through access re-expansion, Medicaid re-expansion, and other portions of the Affordable Care Act.
You actually went to Duke and you found your way here to Arizona and then to El Rio. Were there supports in place that drew you here?
Well, I have to say I'm really lucky to be able to be here in Tucson and particularly at community health center like El Rio. But the path that I came to El Rio is that when I was going to medical school, I knew I wanted to provide primary care and work in an underserved area. And there is a program called the National Health Service Corps, and they provide both scholarships to fund people through medical school, but also loan repayment to help people repay those enormous loans that they come out of medical school with. So this is a program that our government offers to really allow people to be able to follow their heart, follow their mission to work in underserved communities in primary care. And I want to say, just as we really breathed a sigh of relief that this current bill has been tabled, we are still in a moment of jeopardy. And I'm not sure if many of your viewers have heard of the Community Health Center funding cliff. But essentially what that means is by the end of this week, if our congresspeople don't act, the funding for community health centers will expire by September 30th. And what that is it's a multi-component program that really allows community health centers like El Rio to anticipate and meet the needs of vulnerable populations, both now and in the future. So this pot of money funds 1,500 community health centers across the nation. They serve 27 million people across the nation, and they do it through 3 different mechanisms. One is direct funding to community health centers, so they provide a portion of community health center budgets really to help to defray some of the costs of caring for uninsured people. There are 2 other programs that this supports, and these are also ways to bring providers into underserved communities. So one that's very important to El Rio is the Teaching Health Center Fund. And I'm not sure if people are aware, but El Rio hosts training programs, both for medical students and for residents. And these programs are essentially, the idea behind them is to allow learners to train in community health centers so that they not only develop an allegiance to supporting and providing care to this group of people, but they also develop that special skill set that it takes to provide that comprehensive, complex, and excellent care. And the third portion is the part that we talked about, how probably 10% of our providers at any given time are here on that National Health Service Corps Scholarship Fund. Many of my colleagues have come to El Rio through that program. And again, it's a way to really encourage excellent providers to come to places like El Rio, to come to communities like Tucson and stay to provide their expertise to this community.
And if those supports are gone, I mean, it has a ripple-down effect to the patient population that ultimately affects the landscape of a community.
That's exactly right. I think people walk around thinking sometimes that patients with insurance are immune to these kinds of issues, and I think that we in Arizona really had the experience that that's not the case. So during those few years where we did not have access or Medicaid expansion, we saw our local hospitals go into deep debt. Because they had so many uninsured patients that they were trying to take care of, because insurance sometimes doesn't take care of some of the services that we need to offer patients to be able to be successful. Both health centers and primary care providers and hospitals were having struggles financially to be able to provide the quality of services to the entire community. So I think insured or uninsured, we will all feel the effects if funding goes away.
The attempt at repealing and replacing the Affordable Care Act started to come off the hinges late last week when Arizona Senator John McCain announced he would not support it. This after Arizona Governor Doug Ducey said he would. That came after a phone call from President Trump. A clear divide in Republican politics. Here's Mike Sunnucks from the Phoenix Business Journal.
Well, the governor has done a good job, like I mentioned before, at breaching the two wings of the party, the kind of moderates, the business folks, the Chamber of Commerce folks, and the more populist Trump folks, the folks that back Joe Arpaio. You kind of saw this with the governor and the Trump pardon of Arpaio, where he didn't condemn it, he kind of supported it, but he didn't come out and endorse it. And he's had good relations with Flake, with McCain, and Ducey's been quiet on a lot of these issues. He's a business guy, and he's been very careful to stay out of the fray on a lot of these things. So him sticking his neck out a little bit was extraordinary, so a lot of people noticed that. That's why we're talking about that. I don't know if they're going to have poor relations going forward. They've had pretty good relations going on. Ducey's been a pretty good job of getting along with people, even when they have some disagreements on things. And on most issues, they do kind of line up together. But with McCain and Trump, it's oil and water, and anybody that gets caught in the middle, there is some peril in that. You know, do you have to choose sides? And we'll see if the governor has to do that.
Okay. Politically, is Governor Ducey playing it safe for now?
This is a tough issue. It's a tough issue for Republicans. Republicans don't like talking about health care. It's complicated for them. They can talk about tax cuts and the size of government and national defense pretty easily. But when they get into health care and the Affordable Care Act, Obamacare, they've really struggled. They struggle nationally and at the state level because they don't like the mandates on individuals and businesses to provide care. A lot of Republicans see it as an expansion of the welfare state and a move towards socialized medicine like Canada or what we see in Europe. So philosophically, they'd love to see it go, right? They've campaigned on this for years now. But when it gets down to the nitty-gritty, they don't have consensus on this. Folks will bring up how many people will lose coverage, the types of people that lose coverage, the costs that'll go up, pre-existing conditions, what these bills will do to folks who could be denied coverage. And there's human stories there, and it takes a toll on the Republican message, because it's a macro message, to really implement these things. And we've seen this, 3 or 4 times now since Trump has been president alone, that they've tried to repeal this thing and can't get the votes in the Senate. And this is equally tough for a lot of Republicans, at the state level, because you saw governors like Jan Brewer and Kasich and some other ones that expanded Medicaid under the Affordable Care Act, despite opposition from conservatives. And so the governor is wading into this mess. And if they do repeal, it could really hurt Republicans because it could galvanize Democrats. It could really upset people that are losing coverage. And there's some things in the Affordable Care Act that people like, that are popular. Some things haven't worked out, like the exchanges. But I think as he gets into this kind of works against his carefulness that's been his political hallmark, and it could be some trouble for him.
And we have an election cycle coming up, so there could be repercussions.
Already lots of uncertainty because of that, because our Trump voters are going to turn out, our Republicans going to turn out, our Democrats going to be energized. They weren't last time. They're going to be more energized. No one has any idea who's going to turn out. And if Republicans continue to fumble this, and maybe tax cuts if they can't get that done, does that really dampen their turnout? And you could see some issues for people, races like the governor of Arizona, where people expect him to win easily. But if turnout is weird, it could upset the apple cart.
If this does not pass this weekend, or it doesn't go to a vote, what happens? What's next?
The last time it didn't pass, we thought the president and the Republicans were kind of going to move on from this for now, work on tax cuts, look at infrastructure. They got a budget to do. And then this repeal and replace of Obamacare, getting rid of this thing, seems to always dangle in front of them. And they come back and repeat the same insanity and incompetence, a lot of people think, as before. They haven't been able to get the votes, and they're going through this again. It certainly lessens some of the wiggle room they have for tax cuts, which are popular with Wall Street, popular with businesses, kind of popular with both wings of the Republican Party. That seemed like a slam dunk, and healthcare continues to get in the way of this. One thing that happened with this latest bill was a lot of the wealthy donors, conservatives, Koch brother types, Sheldon Adelson types, were upset with the Republicans in Congress for not moving on this, getting this done, because this has been a hallmark of the right for several cycles, and they promised and campaigned on this. And so I think this latest thing kind of came from that, because when the guys with money talk, a lot of the politicians, answer. I don't think your average Trump voter out there, working class, lower middle class folks, healthcare might not be their top issue if the reason they voted for the president. Immigration, trade, jobs, social change in the country. I think those were the main issues. I think healthcare was more of a Koch brothers, more of a conservative, Republican issue, less of a populist issue. And so you're seeing those two things come together. And it's interesting that Trump campaigned against a lot of these Republicans, claimed they were incompetent, couldn't get things done, and now he has to work with these same folks, and is dealing with some of the same dynamics in Washington that he campaigned successfully against.
What becomes of healthcare throughout the country and here in Arizona? The Hertel Report is a go-to Arizona publication focused on healthcare. Jim Hammond now, the publisher, with his analysis on how the state got to where it's at. Did we as a state somehow cause this?
We had some circumstances in the first couple of years that created a lot of volatility in our market. You remember the first year we had 11 carriers, including one of the co-ops, right? So the co-op had a role to go out there and compete. And they were starting from fresh. They didn't have any other business, So United and Cigna and Aetna and the big companies, they have lots of business, and then this was going to be a little project for them. Well, for Meritus, our co-op, it was everything. So they were pretty aggressive. HealthNet was very aggressive. So year one, it was actually HealthNet's turn to be really aggressive. Then they kind of backed off and said, wow, we grew too fast. Let's take our time. And then Meritus, they got aggressive with their rates, and they grew too fast. And they actually had problems meeting their responsibilities. So you had those two players kind of manipulate the market the first 2 years and cause this volatility where people didn't get a really good mix of members. And remember what insurance companies like. They like predictability. They like knowing what's going to happen. They like to know who their members are. And if you've got people switching back and forth these first 2 or 3 years, they really didn't have any kind of feel for how sick is our population. What kind of rates should we be putting out there? And when they don't know, when insurance companies are unsure, their rates go up. And so that's when we had the second and third years where we have these big spikes in rates, because the insurance companies really do not know what kind of mix of patients they're going to get.
Did this competitive marketplace somehow create a system of haves and have-nots?
Well, let me think about that. I think the whole thing before and after and during this is a story of have and have-nots. It's just who those people are. The ACA has done a great job of helping those 20 million people that it helped find health insurance, and I can't remember the number, maybe 50 million people on Medicaid. It helped them. For them, it's a good story. But if it created a situation where your premium went up, you were insured before, but your premium went up, you immediately go and blame this other thing. Oh, they got health insurance for free or for a low amount, so I'm paying more. Well, that causes this feeling of this, there's something broken here. But that's what insurance really is. It's everybody throwing into a pool, and then there's lucky people and unlucky people, and the insurance is there to help the unlucky people. And a lot of folks don't recognize that. They want to get something for their money.
Are you suggesting then that more power should be given to the states when it comes to health care?
Well, I think that's certainly an answer that could work. Let the states work this out. One of the concerns about this bill is that happens 2020. That happens in January of 2020, which means all 50 states are going to have to figure out what they're going to do by January 2020. That's a very quick turnaround for states to, one, they have to pass their laws about what are we going to cover? How are we going to tell insurance companies what to do? Are we going to let insurance companies do underwriting? Are we going to let insurance companies rate people up for pre-existing conditions? Are we going to let insurance companies change the minimum benefit plan so that lifetime maximums come back, or you can cut out mental health benefits? Are we going to do that in a state? Right now, our state is a leader in integrating mental health and physical health with access, and at the same time we're looking at cuts. And people are saying, well, we'll just cut mental health benefits. Well, that's kind of contradictory to what the path we're going down right now. So there's a lot of hard decisions those states are going to have to make. And then they have to have infrastructure. One of the things that I have not heard a real straight answer on is, will healthcare.gov survive? Because healthcare.gov is the vehicle where 35 states have their folks choose these plans. Well, if that goes away, then those 35 states have to come up with their own exchange to do that.
Because under this bill, you have to still honor pieces of it that are in
The
existence.
ACA is still in existence, but there's a lawsuit out about the funding of these cost-sharing reductions, and the Trump administration has been kind of dangling every month saying, okay, we'll go ahead and give you that money next month. And so the insurance companies don't know what's going to happen next month, let alone next year, and they've already put their rates in for next year. And so a lot of them fudged their rates up a little bit because they could get the cost-sharing reductions taken away. That's an area where there's still uncertainty. We still have 2 years to go in the old law, but between now and then, those insurance companies need to know how much the federal government is going to support these low-income people when they go and they purchase health care. And it's really, it's a domino effect or a cascading effect where if the federal government doesn't give this money to the insurance companies, then the insurance companies don't give it to the providers. And the providers go, hold on a second, this person came in, we thought they had a $40 copay, they paid us $4 because that's what it says their copay is. We were going to get the other $36 from the health plan. The health plan says, no, we didn't get the money from the federal government, so you're not going to get the money. So then now you're going to have providers that have bad debt, essentially, from low-income people. And so this could cascade into making life even harder for people that are making between 138 and 250% of federal poverty. And so we need to know what the Trump administration is going to do about that.
It's unclear when we'll see another attempt at repealing and replacing the Affordable Care Act, though high-ranking members of Congress have said the next big move in Washington will be tax reform. And that's our program. Thanks so much for joining us.